ACO and how it works for the good of all its participants. And Dr. Carlson, first of all, what exactly is this ACO, or that Accountable Care Organization?
Yeah, an accountable care organization is a group of doctors and healthcare workers that come together to help take care of patients, not just when they're in the office, but we try to do a better job of taking care of them when they're in the hospital, when they're in the emergency room, when they visit specialist office and home health. We try to get our arms around taking care of them in all those different places.
So what makes up that quadruple aim?
So the mission of an accountable care organization is to first measure the quality of the care that we're giving to patients and boost that quality, to look at the value. So make sure that that money that's being spent on things that aren't helpful for the patient, we try to move those dollars to things that really do benefit patients. And then engaging our patients. We're trying to get to know what our patients need to help them be healthier and get feedback from them on how we're doing. And then, because this is a lot of extra stuff, we're trying to reduce the burnout in nurses and doctors by developing a bigger team to get all these jobs done.
So what kind of goals does a group like Texoma Care, who's part of an ACO, have for their Medicare patients?
Right, so we have three big goals. One, well visits. So Medicare pays for our patients to come in for their well visits, and a lot of people don't do that. So if they come in for their well visits, we can make sure that they've had their immunizations and their cancer screenings, and if they have diabetes or some sort of lipid problem, we take care of that before it becomes an issue later on. And then for our hospitalized patients, we're making sure that that they come in, that we contact them within a day or two of getting out of the hospital. And then for our really sick patients, we're identifying each doctor's most sick patients, and we're reaching out to those patients in between the doctor's visits.
So then what can the patients do to help this ACO be successful?
Well, first off, be an engaged patient. Ask a lot of questions. Partner with your doctor to be healthy. If you haven't had the Medicare well visit, come in to get that done. And then, this is new to us, so give us feedback on how we're doing. With the things that you think are going well, let us know so that we can make this accountable care organization really work to help make our patients healthy.
All right, great information, Dr. Carlson. Thanks so much for joining us.
My pleasure.
We'll be right back.